My name is Jeremy Lacocque. I'm a EMS and disaster medicine fellow at UCSF. So I work clinically at San Francisco General Hospital, and then as part of my year-long education program in my fellowship, I work with the ambulances, the EMS system, and public health. So today I'm going to use some of my experiences to talk about heat-related effects on the population and the effect it has on our emergency services and hospital system. Okay, so I have no conflicts of interest. A little bit about me. I spent almost my whole life in Chicago before coming here to San Francisco for my fellowship. I grew up in Hyde Park, right here on the south side, and slowly made my way north as I grew up, and was in Bucktown here on the northwest side before coming here. I went to school at the University of Illinois in Urbana, which is just downstate of Chicago, and there is where I started medicine, both in the classroom, but also as an emergency medical technician. So I worked on campus there at events as an EMT, and then during the summers, I would come home and work for a private ambulance company. So I got introduced to emergency medicine while I was a freshman in college, and that kind of helped steer my career direction. Then I did my medical school and residency in emergency medicine at Midwestern University. The school is just west of Chicago, and then the hospitals were kind of throughout the city where I did my training. And then, like I mentioned, since July and until this July, I'm a fellow at UCSF. I do most of my time at San Francisco General Hospital. It's the sole county hospital and trauma center in the city. So it's been a great experience, both in the emergency room and from a public health and EMS perspective. So my objectives for you watching the lecture are for you to understand the definition of a heat emergency, to understand what makes a certain population vulnerable, what makes an individual vulnerable, what the effects of heat are on the EMS system and the hospital systems, and also what you can do to help. So I want to start by bringing you on a shift with me to the emergency room. So I want you to imagine it's October 2019, which is during one of the heat waves we had. Like I said, this is one of the places I work clinically. This is a hallway outside of our resuscitation rooms, so this is occasionally where I walk to see an incoming patient. Whenever someone sick comes in, they announce it overhead, and then we kind of wander through this hallway into the corresponding room to meet the patient coming by ambulance. So an example of a patient that I saw during one of our heat waves in here in San Francisco was a 40-year-old male that had a history of diabetes and kidney disease. He was riding one of the trolleys, felt dizzy, passed out, and fell off the trolley. So here are the paramedics taking care of him. You can see that they're concerned about the fall, so they're holding the patient's head and immobilizing the patient's spine and assessing the patient. So when the patient comes in the emergency room and I see them, it turns out that the patient said that he wasn't drinking as much water. He didn't have much water around him. He was a tourist visiting the city. He was eating a lot of sweet food while visiting. And his blood sugar was a little high because of all the treats he was eating, and was also not drinking very much water while he was exploring the city. So we think that contributed to him being dehydrated and contributed to him passing out. And in addition to that, he hit his head when he fell, so we had to evaluate him for an intracranial injury, like bleeding inside of his brain or concussion. And during heat waves, those with diabetes and kidney disease are more sensitive to heat and being dehydrated because their kidneys have a harder time balancing fluids in the body, and the extra sugar in the body, the kidneys try and get rid of that sugar, but when the body pees out that sugar, water comes with it, so that can lead to worse dehydration. So these are all things we considered when we know the temperature outside is a little hotter than usual. So there's several sources for public education on heat waves, FEMA being one of them. So they have some resources, and this is a slide from them about extreme heat. They mention who's at greater risk, the fact that it can happen anywhere in the country regardless of the normal temperatures, and that humidity makes it even more pronounced when it's hot outside. The general definition I found for a heat wave or a heat emergency was 2 to 3 consecutive days of high heat, and along with humidity with temperatures above 90 degrees. That's where the studies say that there's an increase in all-cause mortality. People having illness and dying from heat is when it's above 90. So the World Health Organization, just to have a common definition, they mentioned that between the year 2000 and 2016, the number of people exposed to heat waves increased by about 125 million. In 2015 alone, 175 million additional people were exposed to heat waves compared to average years. Single events can last weeks, they can happen one after the other, and it can result in significant excess mortality, more mortality than if there were not a heat wave. Exposure to excessive heat has a wide range of physiological impacts for everyone, often amplifying existing conditions and resulting in premature death and disability. The negative health impacts of heat are predictable and often preventable with specific public health actions and individual actions. So the World Health Organization has issued public health guidance for the public and medical professionals in coping with the heat. So this is a graph from the Environmental Protection Agency, and it talks about heat-related deaths between 1979 and 2014. And you can see that each spike generally corresponds with a heat wave. So they differentiate between the underlying cause of death and the underlying and contributing causes of death. So the underlying cause of death, that might be a direct cause of a heat wave. So the heat itself contributed to the mortality of the patient, whereas contributing cause of death, the heat may have contributed to the death, but it's not necessarily the primary cause. So that's, I think, the differentiation they're trying to make there. These are summer deaths related to heat and cardiovascular disease, so specifically heart disease, which heat can exacerbate. So you can see the purple line is for those 65 and up. The fact that the death rate is higher in that population helps highlight the fact that they're more susceptible to heat. And of course, they're more likely to have other illnesses and other things going on given the age. Unfortunately, non-Hispanic blacks are more vulnerable to heat, as you can see, and then the general population is the lowest on there. But also these spikes correspond to known heat waves. So these are heat-related deaths in a 1995 Chicago heat wave. I did pull some data specifically from San Francisco, since that's where I am now, and also from Chicago, since that's where I'm from. And what I thought was interesting is that there was a pretty big spike during a heat wave, but the green line represents the heat, and the red represents the daily deaths. So you can see that there's, in this case, a lag between the heat and the death. So sometimes the heat can cause mortality, within the same day or almost right away, depending on exactly what's going on, or it can cause an exacerbation of the patient's existing health problems and lead to mortality in the next 2, 3, 4, 5 days. For instance, someone could have COPD or emphysema breathing problems. The heat can contribute to making it worse, and then they go to the hospital, and then they end up passing away a few days later. That's one way that heat can affect people. This is another set of data from the EPA that I thought was interesting. So it shows the change in unusually hot temperatures in the United States. So the big orange triangles show an increase in heat, whereas blue shows a decrease in temperature. So you can see the East Coast, the West Coast, a little bit of the South is affected more so than other places. But we've all heard of heat waves in the Midwest as well, and I'll discuss some that happened in Chicago, even though the average hasn't been increased, according to this graph. So just to talk a little bit about who is most affected by heat. Starting on the left, those who are less able, disabled, they're less able to change environments. If they're bedridden or if they use a wheelchair, they may not be able to as easily get up and go to an air-conditioned cafe or go to a library that has air conditioning or relocate. They may have a harder time getting water on their own. They may have a hard time communicating thirst if they're not able to communicate like other people. They may have a more difficult time going to the bathroom. So, imagine if you have a hard time going to the bathroom, you may be less motivated to drink water because you don't want to get up and go to the bathroom more often than you have to. So those are some reasons why those who are less able may be more susceptible to heat. Those who are pregnant, the body's already stressed from supporting a growing baby, so heat and dehydration can have a larger effect on that population. Those who are already sick, already have a physiologic stress on their body, so heat can stress the body even more. And the more you stress the body, the more it has difficulty healing itself, and the more likely it is to have worse symptoms and recover. The poor, the displaced, the homeless, unsheltered, they have similar to some of these other populations, they have a more difficult time finding cool shelter, having access to shelter, finding access to food and water. They have limited access to healthcare in some instances. So all of these things that some of us take for granted are more difficult for these populations and can contribute to them being dehydrated and becoming more ill. Children, the elderly, in general, the extremes of age like that are more susceptible to all kinds of diseases, including heat. They can be less sensitive to thirst and messages the body's trying to send them about feeling dehydrated, especially the elderly. They have a harder time feeling their sense of thirst and responding to it as we might when we're younger. And especially those who are bedridden, like I mentioned, they rely often on loved ones or staff members to bring them water, and unfortunately it doesn't always happen to the extent that's needed. So those who are in nursing homes or bedridden can get dehydrated a little bit more easily because of that. It's pretty common in the emergency room that we'll get someone, especially during a heat wave, from a nursing home, and we'll find that they have hypernatremia, high sodium, and that just is often a reflection of the fact that they're dehydrated because the relative amount of water in their bloodstream is lower, so their sodium appears to be higher. So sometimes we have to admit people to the hospital for their dehydration and give them a lot of fluids to get them back to normal. Finally, another vulnerable population are the outdoor manual workers. They may be previously healthy 25-year-old workers, but when they're outside in the heat all day working, they may not have a cool place to take a break. They may have limited access to water. They may also minimize their symptoms. If they're there at work, they may feel peer pressure to keep working. They may rely on the job for income. So, some workers just keep working even though they're uncomfortable. And they may also have protective equipment, helmets and jackets and gloves, things like that may make it more difficult for their body to get rid of heat and thermoregulate. So this is an interesting graph I found from the World Health Organization that I think is a good talking point for the different populations. So I want to break it down between indirect impacts of heat and direct impacts of heat. So to start with indirect, it affects our health services. It affects us because there are increased calls for ambulances, and eventually if we only have a certain number of ambulances available in the city, if there are more ambulance calls, those number of ambulances may decrease, which means that there will be a slower response time. So if a bunch of people call 911 because they're feeling hot or weak, or they get injured while playing outside, and then all of a sudden someone has a cardiac arrest, there may be a slowed response time to get to that person because all the other ambulances are busy with those previous calls. So that's something we're continuously mindful of when planning and strategizing in the pre-hospital system. Working with ambulances and health systems is to try and make sure there's enough resources for everyone. So during a heat wave, it's definitely a bigger stress. So one way that we help plan for that is usually during a heat wave, we'll assemble in the Emergency Operations Center, which is just a general meeting place, often at our 911 center. And we have the sheriff and Department of Public Works and representatives from hospitals and the EMS system, and we all work together to help plan what the best way is to mitigate illness and to plan the responses and make sure we're helping hospitals as best we can, and we just have like a bird's eye view of everything that's going on to help plan for those things. There could be a shortage of medications. More people might get admitted to the hospital, which means that more people will spend more time in the emergency room and be stuck in the emergency room before they can physically go upstairs, which can affect their care. There's increased risk of accidents like drowning if people are outside because it's hot and they're trying to cool down or just enjoy the weather. More people will be swimming, which therefore increases the risk of drowning. There's more work-related accidents, injuries, and poisonings. And being in water can increase the rate of disease outbreaks, but additionally being inside and people all being together in close quarters can increase the rate of transmission from one person to another. We find this to be the same in the winter, like during flu season when everyone's together in the house and no one goes outside. There's an increased rate of transmission, so it's similar with hot weather. And then this can affect our infrastructure. So if more people are at home than usual as opposed to outside, there's going to be more electricity used, more water used. If people are using air conditioning, that's going to use more power, so that can put a stress on the city's power resources. And same goes for water, transportation. There may be reduced productivity because fewer people can work. In terms of direct impacts that heat may have, it can cause heat-related illness like dehydration, heat cramps, heat stroke. It increases all-cause mortality, so especially from respiratory problems, heart problems, and other chronic disease like mental health increases, kidney disease. In Chicago, unfortunately, there was, we all know there's shootings and violence there is pretty prevalent, unfortunately, and usually on a warm summer day there would be more shootings than on a colder day because there's more people out and about. So that was a big consideration, especially in a big urban city like that, where violence is unfortunately more common. And hospitalization is more frequent from respiratory, the same set of disease: respiratory disease, diabetes, kidney disease, strokes, mental health. So this is just another illustration of direct versus indirect effects on health. Again, if it's hot outside, especially if you may not have air conditioning, more people will be outside playing. So if you're outside playing and jumping in pools, you're more likely to get hurt, which can cause downstream effects. If you get hurt, then maybe you call an ambulance, and more people call ambulances, and more people go to the hospital, and that puts an overall stress on the system. And on the right side, my intention isn't to have you read everything on there, but the idea is just to highlight the general categories of direct heat-related illness, like heat stroke, when people are confused and have what we call an altered mental status. It's definitely life-threatening. The skin is sometimes damp, but could even be dry from dehydration. The temperature is 103 degrees Fahrenheit or higher. So that's the extreme. That's a medical emergency that you want to call 911 for. Below that, there's heat exhaustion. That's a lot of people get fatigued. There's lots of sweating. Heat cramps is more on the milder side. It's just more muscle pains. And then, there's sunburn and heat rash. So those are all illustrations of direct heat-related illness, which we also see an increase of. But I think the underappreciated portion of heat waves, I think most people think of these things of like heat strokes, but it's important to realize that it really affects all types of health conditions and affects the whole healthcare system, not just from people having heat strokes. So this also affects the healthy population. This also affects teenagers, 20-year-olds, 30-year-olds, 40-year-olds who are outside trying to enjoy themselves, especially in the case of a marathon. So when I was in Chicago for several years, I'd volunteer at the marathon, and it's something I learned to appreciate, that even if it's 65 degrees outside and it's a beautiful day and everyone's happy and healthy, once you get into the race, halfway through the race, especially toward the end of the race, I worked in a mobile hospital tent they had there, and it was a decent amount of patient flow in there, just because when you take someone healthy, even if it's 65 degrees outside, but if you run for hours, especially if you haven't trained yourself adequately to do so and you're not replenishing your fluids, then it can create a medical problem that may not have been there originally. So this is an extreme example. In 2007, it was very, very hot outside, and the race ended up being canceled after it had started, but a very large number of people needed medical attention. One person unfortunately passed away. It overloaded the EMS system in the city, so they had to call in ambulances from different towns to help. There is one hospital in the middle of downtown in Chicago that received a lot of patients, but then the other hospitals also became overwhelmed as that one became overwhelmed, so it had a big downstream effect. So in terms of what is a heat emergency, we talked about some generic text definitions, but it's also important to appreciate the relative difference of what a population is used to versus what they might experience. So in Chicago, this is the average weather in Chicago throughout a general year. So as you can see in January, February, it's generally pretty cold. The low temperatures around 20. Last winter I was there, it got to like 20 or 30 below zero, so there's definitely exceptions. But in general, it's in the 20s, and then in June, July, it can get up to the 80s. So as a Chicagoan, myself and most of the people that live there got pretty used to these extreme temperatures. The majority of people that had the resources to do so had air conditioning and heating, and they were accustomed to this type of weather. So there definitely was heat-related illness and indirect effects, but it didn't faze most of us if it was 0 degrees or 80 degrees. Most of us were physiologically a little bit more prepared for it because we lived there through the years, but also logistically we're more prepared for it because it's something that was kind of normal. So this is in contrast to San Francisco, where the temperature is much more moderate and consistent. It doesn't really get colder than 45 degrees. It rarely gets higher than 70 degrees. There aren't really seasons as much here. It's more just kind of mid-range every day, and occasionally there's a hot day and occasionally there's a cold day. But you can see in September it kind of spikes up to 70 degrees as a high, and then it gets kind of lower in July. I remember on my first few days here on the 4th of July, I expected it to be hot like it was for the first few decades of my life, but we went outside to grill, and we were all wearing jackets, and it was freezing on the 4th of July, and that was just really shocking to me because it was supposed to be summer. It's supposed to be a fun barbecue on 4th of July, but it was cold and a much different experience coming to San Francisco. So take into account what the existing population is used to can affect how it affects their physiology and their existing health. So with that said, things like this were surprising to me. 76 degrees outside, there were public health notices about staying safe and drinking lots of water. And this was surprising to me, of course, because 76 is a beautiful day in Chicago, and I wouldn't think twice about it. But again, here, 76 is much higher than what the population is used to. And the infrastructure is different. People don't really have air conditioning in San Francisco, so it was an early reminder to me that different places experience these temperatures in different ways. So these are just here's another example of social media mentioning that it might go up to 80 degrees and emergency alerts being sent out because of it. So people kind of make light of it, but it's also a very significant thing for certain populations. So this is June 2019. You can see that the general high normally is like 51 to 66 degrees. The low is roughly the same. But in June, we experienced some record temperatures, 91 degrees, 97 degrees. So in a place that's not used to that type of temperature, that doesn't have air conditioning, that doesn't have a population that's used to that type of temperature and temperature change, it can have huge effects. So it did have a big effect on our city. So again, as part of my fellowship, in addition to working as an emergency room physician, I also, like I said, pay a lot of attention to how these things affect ambulances and the pre-hospital emergency response system. So this is some data about how heat affects ambulance calls. So there's a lot of numbers on here, but basically what I want you to appreciate that in 2018, in the same time period when there was not a heat emergency, there was a little less than 1,000 calls for EMS. But then this year, there were 1,315 calls. So there was an increase in calls. Generally, we expect maybe like a few percent, maybe up to 5% increase in EMS calls naturally every year. But this is obviously a little bit more than that, that we are attributing to the fact that there was a heat wave. So this is a graph of all the 911 calls in the city. So in 2018, when the temperature was a little bit more predictable and there was not a heat wave, you can see the hourly events, goes up toward the evening and then goes down at about 5 in the morning. Usually in the evening is when EMS and emergency room see the busiest times. So you can see it's pretty consistent. This is, the low and the high. It's pretty predictable. But here in 2019, when we experienced some heat, you can see that this line of events spiked, especially around the evening again, here and again here the next day. So this is much more than we expected. So this has a lot of implications because it means the ambulances are busier, which means that the hospitals are busier. But although we can plan to some extent when we expect weather to happen, sometimes these heat waves happen without much anticipation. So, this affects how our various EMS providers plan for staffing. If the heat wave comes kind of unexpectedly and all of a sudden there's an increase in calls, it's not really logistically easy to suddenly call in enough staff to add more 10 ambulances to the system, especially in the middle of the night. So that often means that people have to wait longer for an ambulance because the ambulances are busier. And if the hospitals are busier, that means it's more difficult to take the patient that the paramedics have and offload them in the hospital because they have to wait for an available bed before they can offload the patient and go on to another call. So it really affects the whole system. So the more that we can predict these things and be prepared, the better overall. But the frustrating thing, like I allude to, is that it's not always predictable when this can happen. This is a heat map of the city and how many ambulance calls there were. So this is 2018. The hot spot right there is the Tenderloin, which is kind of an underserved neighborhood in the city where a lot of people are unsheltered and underprivileged. So that's the highest spot of EMS calls. And then it just kind of dissipates as you get to the less populated areas of the city and to the higher socioeconomic class that tends to have air conditioning and better health care and things like that. So this is compared to 2019, which you can see the call volume was higher and affected more of the population. So this table summarizes the impact on healthcare facilities. So this is a list of our hospitals and diversion hours. So when a hospital gets overwhelmed and they have fewer and fewer resources to take care of new incoming patients, they can go on divert, which means that it's basically a request to the EMS system to say, hey, we're really busy. As long as the patient isn't extremely sick, it's a request to take them to a different hospital so that they don't get an unsafe number of patients. So this is a big issue in San Francisco because we're kind of a geographically smaller area and we're surrounded by water. So if one hospital goes on divert, it can very easily lead to the second closest hospital going on divert, which causes the third one to go on divert. And then ambulances have to constantly scramble to find a hospital that's open, and it's just like a downstream cascading effect that happens every time our system gets busy. So you can see our main hospital, San Francisco General Hospital, was on divert the most, and then Van Ness, which is another one of our hospitals, was on divert quite a bit, and then so it has downstream effects. And then most of the comments, sometimes it has to do with inadequate staffing, sometimes it's overcrowding. Saturation's another way of saying overcrowding. So this is another example of how it can affect our EMS system. This is another graph of just general healthcare facilities in our system, not just hospitals, but also urgent cares, family health centers. We have a sobering center where we can take people that meet certain criteria and may have maybe intoxicated from alcohol. So this compares the outside temperature with the inside temperature. So you can see one of these urgent cares, even though it was about 90 degrees outside, or in this case, just a little less than 90, it was 101 degrees inside the urgent care. So not only are there more people that need care, but the places that usually provide the care are suffering themselves because not all of them have air conditioning. In addition, in the last heat wave we had here, I believe in September, one of our nursing homes, the air conditioning went out. So the whole building was 90-some degrees Fahrenheit, and of course the people in the nursing home is already a vulnerable population. They're older, they have comorbidities and other diseases. So we had to scramble and plan on how to evacuate an entire nursing home and bring them to other places so that they could be safe. Luckily, they fixed the air conditioning in time and we didn't have to do that. But having to imagine using all of these ambulance and EMS resources to evacuate people and take them to other facilities that are already overwhelmed would have been a huge undertaking and a huge tax on the system. So it's important to consider not only the effect this has on people and ambulances and hospitals, but just general facilities where people reside. It has a big effect. So I'm going to bring you to another patient that I saw. This one was a 55-year-old male that arrived after overdosing on a psychiatric medication. He was confused, but seemed stable and was able to talk. His ID said that he was from Santa Rosa, which is in Sonoma County, which was reflective of the fact that we had some forest fires going on. So this was during the Kincaid fires. It displaced a lot of people, and they needed somewhere to go where they could be supported. Their general support system and their house. There were mandatory evacuations. So many came to San Francisco to stay with family, to stay with friends, or some of them were unsheltered and came because we have an infrastructure for helping people that are unsheltered. So this led to an increased need for shelters in San Francisco. So one of the places that stepped up to help was the St. Mary's Cathedral. It turned itself into a shelter, and it was very impressive. I mean, there were nurses there to help with health care. There was pet care. There was food. There were televisions and toys for children. There were cots everywhere. It's very it's sad when disasters happen, but I always think it's beautiful when you see people and how they respond to it and how much we can do in even a short period of time. Like I mentioned, to try and mitigate the stress on our healthcare system, the Red Cross offered some nursing staff that was in there to help with the bumps and bruises and coughs and things like that help to help the population there so they wouldn't have to depend on the EMS system and our hospital system to help with those things. But even still, it poses a unique stress in our healthcare system because the patients that come to shelters are from out of town. They're away from their normal care, away from their pharmacy, their primary care doctor. They don't have their normal medical equipment that they have at home, whether it's a CPAP machine or a walker or whatever. They may not have been able to bring it with them. So if you don't have your normal transportation, your normal doctor, your normal medications, that eventually leads to being dependent on our healthcare system. And if you don't have a way to get to the hospital and you don't have money, you don't have resources, it increases the likelihood that people are going to call 911 for help. Which increases the stress on our EMS system and our hospital system. So this is an example of how heat can affect the environment and then affect populations in our system downstream. So as part of my job working at San Francisco General, being involved in EMS along with a lot of the other emergency physicians that are there, we're trained to answer calls that come from ambulance crews. So if they have any type of question or they want to use a specific medication, or in this case, if they think their resuscitation efforts for a patient are futile and the patient's not able to survive whatever's going on, like a cardiac arrest, they'll call us for our approval to pronounce the patient. Those are always difficult calls because we can't see the patient. It's kind of emotional. It's a tough thing to say over the phone, but occasionally it does seem like the right thing to do if you feel like there's nothing that the hospital can do differently for the patient than what the crew's already doing. So in this case, there's a ring overhead. So this is our communications room. That computer there in the middle is where we answer the phone, and then we can talk to the crew directly that's calling us on a phone. So they called me about a 65-year-old male that had a history of heart problems and emphysema, lung problems. He was staying in the shelter and was displaced by the Kincaid fires. 911 was called because he was found to be unresponsive. The paramedics couldn't find a detectable heart rhythm, and the entire time they had been with him, he didn't respond to any medications or any interventions. So after 30, 40 minutes of resuscitation, I agreed with them that unfortunately, medical efforts would be futile and the patient was pronounced dead. So this is, unfortunately another example of someone who probably had exacerbated health problems because of the heat, because of being displaced, and this is something else that our healthcare system and our loved ones and our neighbors experience because of heat. So I thought this was interesting. This is a study done on cardiac arrest in relation to California wildfires. So that the part I want you to pay attention to is just here in the conclusion about how cardiac arrests increase with wildfire smoke exposure and lower socioeconomic status appeared to increase the risk. So unfortunately, there's another example about how socioeconomic status can unfortunately put someone at a higher risk of getting disease and a higher risk of mortality. And in this case, it correlates with smoke exposure. And this is part of the paper. This is the pathway that they think may contribute to that. So, I don't think it's worth going through it detail by detail. But basically, inflammation and body stress leads to increased blood pressure and progression of, plaques in the blood vessels, which can lead to heart failure and strokes and heart attacks and even blood clots in the lungs, arrhythmias, and all that can eventually lead to cardiac arrest. So in terms of what we can do to help, the fact that you're watching this lecture shows that you're invested in education. So education's a big portion of this. So social media, posters, word of mouth, everything like that is all part of an important dissemination of information and education, so people are aware and can be proactive about their health. If they know heat is coming, going to a family member's house, maybe a couple hours away, even if they have to, that has air conditioning or resources, or stocking up on some water, or if they're able to buy an air conditioner before the stores run out and having it. Or if a family has a loved one who's a little older, being sure to check on them or bring them over to their house where the air conditioning is better, things like that. So education, being proactive, is definitely a key point. So something we do on our end in terms of the Department of Public Health and Emergency Management is, send out these tweets, and you saw from the social media posts in the beginning of the presentation that people get notifications on their phones. So that's a big part of kind of like a community-based effort to keep an eye on each other and be aware of what can happen. So something you as an individual can do to help in these cases are to keep your windows open at night if it's safe, and to close them during the day to help get the cooled air in at night. Something else you can do is to try and keep your house below 90 degrees. Like I mentioned before, 90 degrees is kind of the tipping point for a lot of people in terms of when the heat really becomes dangerous. And then below 75 degrees at night, especially for those over 60 years old and those who have infants and those with chronic health conditions. Something else you can do is to hang shades over your windows so the sunlight doesn't heat your house, kind of like a greenhouse throughout the day. You can hang wet towels. Electric fans can help, but once you get above 95 degrees, they're not as helpful, but it can help circulate air in the house and help with convection, like getting hot air off your body and blowing it off to cool yourself off. If you can't avoid heat in your home, trying to spend 2 or 3 hours a day in a cool place can make a big difference. So in San Francisco and a lot of other cities, sometimes we have city buses that have air conditioning. Interestingly, most of them don't have air conditioning here because it's not needed often, but some of them do have air conditioning, so you can put people on buses that cool them temporarily. Some, but not all, of our libraries have air conditioning, so I believe our main public library does, so people can go to the library to get hydrated and cool off. So, public areas are a helpful place. I remember one of the hospitals I worked at in Chicago before coming here, people didn't necessarily have medical complaints, but they were hot. So, we let them sit in the lobby or the waiting room. Or on a normal day, we might be like, hey, if you don't have business at this hospital, maybe you shouldn't sit here all day. But, in cases like this, we welcome people to sit in a cool area to prevent them from having health problems and making sure they were hydrated. And if you do any strenuous activity, try and do the coolest part of the day, 4 and 7 a.m. So, if you're someone who likes running first thing in the morning, being mindful that going running at 6 a.m. might be a little bit better than going at 7:30 when it'll be a little bit hotter. Of course, don't leave your children and pets in the car, because the car can get much hotter in the inside than it is outside. So other things you can do are try and keep your body cool. You can do that by taking cold showers, cold baths, hot packs, towels. I think foot baths are pretty easy. You can get a bucket, put some ice and water in it, and especially for older people that may not be able to take a shower really easily, you can put their feet in it, and that can help cool them down. Drinking water regularly, especially uh, more than you think you might need, just having glasses of water next to you throughout the day to make sure you stay hydrated. You want to avoid alcohol. It's something that causes you to urinate a little bit more often, so that can contribute to dehydration. Same thing with caffeine, that can raise your body temperature a little bit since it's a stimulant. And sugar can cause part of the way your body gets rid of sugar is by peeing it out in some cases, especially if you're diabetic. So that can lead to dehydration, and can also increase your metabolism, which can increase the your body temperature. So avoiding those things is good. And similar to the metabolism with sugar, eating meals that are smaller and eating them more often can help as well. If you eat like a big meal full of protein, then your body creates a lot of metabolism to break that food down, which can increase your body temperature. You of course want to be mindful of others. Check on family, friends, neighbors. You can check on them physically or call them often, or whatever means that you normally communicate with your loved ones. Elderly and sick people living alone should be checked on every day, and if possible, having them in your house, assuming there isn't a pandemic, having them in your house to make sure that they're safe and staying hydrated is always ideal. Being mindful of medications is important. Some people take medications that may lower their blood pressure and may cause them, like a diuretic that may cause them to urinate a lot. So being mindful of how those medications may affect them, and staying kind of ahead of the curve with keeping them healthy and hydrated is important. And then I think, maybe I'm biased, but I think everyone should have a basic level of knowledge of first aid. So especially you should know if you or other people feel unwell. I think the most important thing that anyone could know is what's normal and what's not normal. You don't have to know medicine. You don't have to know advanced physiology. You don't even have to know first aid. But if you know something is not normal, that's the most important thing, because then from that point you can ask for help or call your primary doctor or someone, or a loved one's primary doctor. You can go to the hospital, but knowing that something is not normal is the first step, and then you know that you can do research after that. Especially if you or someone else feels dizzy, weak, anxious, if you have a headache, if you feel thirsty, definitely move to a cool place first. And if you don't feel better after drinking water in a cool place, after 10-15 minutes, you should probably seek help. Another important point, especially, people may have heard this when running marathons. Water is a great way to rehydrate, but it doesn't have electrolytes in it. So when you sweat, you don't just sweat pure water. You sweat salts along with water. So, it's important to try and replace what you're losing. So drinking things with electrolytes is important. So sports drinks is one example, although a lot of them have sugar in it, which, like I mentioned before, can lead to dehydration. But there's some drinks made for children that have less sugar in it, or there's sports drinks that are diet or have less sugar. So those are great to have and drink, especially when people have kidney disease or are older and aren't able to, their kidneys aren't as healthy to manage their hydration, their electrolytes as much. And again, if you start having cramps or feeling abnormal, especially if it lasts more than an hour and it's not getting better with rehydration, definitely a reason to seek medical care. In terms of first aid, as best you can, you want to move the person to a cool place, put them in a flat position, elevate their legs. The idea behind that is if they're dehydrated, this can help with their circulation. Some people say that doesn't actually help, but it's in the general recommendations from the WHO. You remove the clothing. You can put cold packs. This is something we do in the hospital. You put cold packs in their groin and their armpits, because that's right next to their arteries, so that can cool down the blood and cool down the body more quickly. You can spray them with water and then fan them with an electric fan or anything else, a pillowcase or whatever you have, and that helps get the hot air away from the body and cool them down. And then measure the body temperature if you have a thermometer, and that can help give you an idea if they're overheated or not. But again, I think first aid's important, but you don't want to do something like this and cool someone down for hours and then that's it. This is something you would do until the ambulance arrives or until you get to the hospital. Or if it's a really young, healthy person, I suppose you can try and rehydrate and take a cool shower before you seek help if the person feels okay. But really, I think the big take-home message is if something doesn't seem normal, you don't feel normal, try to rehydrate, try and be in a cool place. If you don't have a cool place, taking a cool shower with supervision, because you don't want to pass out in the shower, are going to be the key points. So at this point, I'd love to answer any questions any of all of you have. It's been a pleasure and an honor to be part of this lecture, and I appreciate you joining. Yeah, so someone brought up attic fans, which is, I remember in the house I grew up in, there was a huge attic fan to take the hot air that's rising and blow it out of the house. So that's something, if you have available, that you can use. So I'm looking at a question from Justin. How can we research hospital statistics on patient availability in California, specifically in LA, during different public health emergencies? Do you have any research on how air pollution is intensifying the harmful effects of COVID-19? Hospital statistics are, you might be able to find if they're published after the fact. I think once all this kind of simmers down a little bit, people will be publishing a lot of studies and talking about how their local area responded to the pandemic. So I think that stuff will eventually be available. In terms of like real-time information, sometimes counties publish public health data and they have like a dashboard available, kind of like what you see with how many cases of COVID there are and how many people are in the ICU and so forth. But requesting real-time data is very difficult because, of course, everyone's kind of busy focusing on responding to the pandemic. So unless it's been publicized or it's on the county's like dashboard, it'd probably be pretty difficult to find until it's published later on. So a question about air quality. If you're in an area of poor air quality, is that the same as wildfire smoke on cardiovascular disease? I do believe so. I can't cite studies off the top of my head, but I do remember hearing throughout my education that being in an area with a lot of pollution can have similar effects to like cigarette smoking and pollutants. I mean, the idea is that your lungs try and clean up your lungs when you inhale dirt or smoke or things that aren't supposed to be in there. And the more that happens and the more damage happens, then your lungs become kind of fibrotic, like stiff, and then it can affect your lung health. So I can't say exactly what would make it equivalent, but it probably has a similar physiologic effect. Yeah, and then putting someone who's unconscious on their side is supposed to help so that in case they vomit, they're less likely to aspirate or swallow, or rather inhale the vomit that just came out. Because if the vomit goes in the lungs, then that can cause a blockage of the air and eventually can lead to infections and aspiration pneumonia. So the idea is to keep them on the side so that if they vomit, it goes on the floor and not into their lungs. And then there's a question from Bill saying that I use San Francisco as an example. What other areas are seeing more extreme heat waves due to climate change? So I think in, I don't know, 10, 15 slides in, I showed a map of the entire United States. I didn't do too much research on the world as a whole. But in the US, if you remember there, it showed like the West Coast and the East Coast and parts of the South, interestingly, not Texas as much, that was seeing the average number of days that had above average heat or experienced a heat wave was increasing in those areas. So I would say those heat waves are more extreme. If an area experiences a heat wave that's a hot day, that's different than a heat wave where it's hot for multiple days in a row, because then it heats people's houses and buildings more, and then it takes longer for that temperature to normalize. So something I forgot to mention about San Francisco is a lot of the houses are kind of older and made of stone, so they retain heat better than other houses that are constructed differently. So the temperature inside a lot of the buildings here is about 10 degrees hotter than outside. Personally, my apartment has some big windows, so it's almost like a greenhouse in here. It could be 55 degrees outside, but we're hot inside and opening windows just because of that kind of greenhouse effect. So the type of building that someone is in can have a big effect as well. There's another question. Should we train ourselves for hot climate to acclimate better in the beginning of summer? I suppose it depends on what you mean by train. I would probably use the word prepare. Like I'm not sure you could train yourself physiologically in that short period of time, but I would plan to make sure that you're paying attention to vulnerable populations, and maybe if you have an elderly family member that lives by themselves, maybe them bringing them over to your house, you can keep an eye on them, making sure you have water, making sure your appliances are in working order so your freezer doesn't stop working in the middle of a heat wave, making sure that you get checkups and that your existing health conditions are well taken care of before the heat comes, making sure that you have the right clothes, things like that. I think preparing for any disaster, including heat waves, is the key. Another question: do preventative emergency strategies and resources target zip codes at risk, going to low-income communities with emergency interventions? I think a lot of our public education, we try and use, there's definitely social media and using Twitter and things like that, but we also recognize that not all of the population is on Twitter and has access to internet. So we also try and post signs and use like the generic highway signs and billboards. So in times when we have enough time to plan and put that stuff out, it's everywhere. And during this COVID pandemic, I mean, there's signs posted everywhere. It's all over the place. You can't escape from it. So I think, ideally we have multiple methods of dispersing information so that it reaches as many populations as possible, including in different languages. Yeah, so in San Francisco, like many other cities and many other places, there's a lot of different languages here, and a lot of different cultures, which is part of what makes the city great. So yeah, we try and post, I think most public announcements I see in at least 3 or 4 different languages to make sure that we get the most spoken languages. I think on the internet we try and have even more languages, but the things that we physically post, I think there's usually 3 languages.
Thank you, Jeremy. That was an incredible whirlwind of understanding the heat impacts of your giving us a glimpse to your work and what it's like to be an emergency room physician, particularly dealing with this inevitable impact of climate change that will be worldwide and also that we will be experiencing in our own locality. I did get a window air conditioner anticipating the heat extremes that we are likely to have this summer, but I do have to acknowledge that that is something that is not available for people who don't have economic resources. And so very important thing to think about and how to take care of people with who don't have resources. And I think a lot of the questions reflected a concern about that. I had a few other questions that I wanted to ask you specifically about in regards to your work as an emergency physician. As we're experiencing the COVID crisis, we are more and more attuned and aware of the impact of the risks of first responders and medical people to work-related difficulties with COVID. But I wonder if you could address some of the issues of protecting the first responders and those who work in the emergency rooms during periods of extreme heat, both from a physical risk and also issues of morale during those extreme heat periods.
Yeah, I think there's a saying in healthcare that you can't take care of other people unless you take care of yourself. So we definitely, the hospital leadership and amongst us as colleagues, we try and encourage each other to make sure that we're taking care of ourselves and making sure, like, hey, did you make sure you had enough water today? How are you doing at home? Do you need anything? I've been overwhelmed and flattered how many colleagues, partly because we have a baby, but partly because of the pandemic, people ask, can we give you anything? Do you have enough groceries? Do you have the resources you need? And so I think it's important to have that mentality among colleagues to make sure everyone's okay, everyone's safe, and what we can do to support each other. I think, in the case of a heat wave, people might buy a lot of fans and air conditioners before the heat comes, and there may not be many available. So, offering a fan or offering blackout shades or things like that to make sure we all take care of each other. I think we're much stronger as a group when we take care of each other. So that's really important. I think the same goes for first responders. I think they're amongst each other and their leadership, and coming from us, I think education is a big key, and reminding ourselves to take care of each other, because it's easy to just keep going to work and say, I'll take care of myself later. I'll go to the gym later. I'll drink water later. I'll do that later. But it's important to encourage each other to pause and make sure that take care of yourself. Because again, if you don't take care of yourself, then you lose the ability to care for others if you become unwell. So I think it's really
But when I see EMS people out in the community or first responders, they've got all this gear on and jackets. Is that a particular risk for them during their work during extreme heat?
I would say so. Kind of like I mentioned to manual workers being outside, that gear can add extra heat. I mean, firefighters wearing turnout gear, all that extra stuff, it's kind of designed to reflect heat and not contain too much heat. But it still is a risk, and it's something that they're educated on and usually mindful of. They wear it when they're on the actual call that they're going on to respond, but they take it off when they go back to the fire stations, which is important. And then if there is an actual burning building or fire that they're working with, they make sure to rotate out all the firefighters so that they don't get too exhausted in the fire. And when they do come out, they generally, take off the turnout gear, and they're supposed to drink water. And often there's an ambulance on standby to do rehab, we call it, where they take their vital signs and check on them and make sure they can recuperate before they go back into the fire. So it's something that hopefully every firefighter is well educated on, because it's so important in the line of work.
Thank you very, very much for an excellent talk, again, to the view of what your life is as an emergency room doctor, and for providing such an incredible overview of the impacts of heat, and also on all of the incredible suggestions for maintaining our own safety during extreme heats that we are sure to continue to face. Good night.
Thank you, everyone.